dips and the ready to eat food, which should be minimized as much as possible, because what happens is that they have a particular kind of food additives. Now, people are advertising that, it is free from all the
I'm so sorry,
pesticides.
Dr. Deepti, I'm interrupting you. I'm so sorry I'm interrupting you, but PPT is
Yeah.
not moving. Your slides are not moving.
My slide is right now, it is nutritional management. Where is my slide?
First slide, your introductory part in Dr. Deepti, clinical and therapeutic nutritionist. That's it. First slide
Seriously?
number one. Yes. No, it's not moving.
Oh, you should have told me earlier. Because earlier it was moving. Just a sec. I'll share it again.
Yeah.
Because earlier when we checked, it was moving, right?
That time it was moving, but now it's not.
No issues. I'll just redo it. Don't worry.
Thanks, doctor.
No problems. Now is it moving?
Yes, yes. Perfect, doctor. Thank you.
So no one, I mean, you must have not seen the slides. This is the digestive system which I was discussing out, and this is the gut and nutritional link. Again, what causes poor gut. I have already discussed it, which you must have listened. Uh, so I was on this slide, brain and gut connection. Post that, this is healthy gut plan lean, which means that we have to follow a good lifestyle with exercise, a good attitude, because definitely a negative attitude will cause release of cortisols, stress hormones, and that can hamper all the other three things. And then the nutrition. So nutritional management, this was the slide I was discussing, that in nutritional management we have to first consider that it has to be a balanced diet with which is rich in immunonutrients, antioxidants, and good fat. Along with it is pesticides and chemical free. So right now, I guess the major education which I give my patient is that I know it is very difficult to cook food at home, but more you are eating homemade food, better your gut is, better your health is, because all the outside food, all the ready to eat food is full of chemicals and bad fat. These are two things which we are fighting, and to just prevent that, the easiest way is that if you can go through a homemade food which you can repeat also. There are a lot of people who tell me that, how can we have a vegetable which was cooked in the morning, I mean by the time in the evening it is not that nutritious. But I always say that outside food has zero nutrition. So the moment you are preparing, you can prepare more and you can repeat that same food. It will still have more nutrition when, instead of you're buying from outside, or instead you are opening a MTR packet and having the food. Other than that, exercise, sleep, and recreational activities to de-stress are also very, very important for your gut health. When I say gut, the major thing is gut microbiota, and it has major four main functions. First is that it promotes digestion by facilitating the absorption of nutrients. So the moment you have a healthy gut microbiota, what happens is that whatever food you had, what all the nutrients it had, it are better absorbed in the body. So it also helps our digestive system to function properly. So all the food is well digested. You will not have all those belchings, abdominal pain, because your digestive system is working well, because your gut microbiota is there. Also, it increases your immune system. It plays a defensive role in the development of immune system, and also creates a barrier against pathogens and toxins. Basically, it helps you to improve your immunity. So major things which we have to consider into probiotics and prebiotics are that right now, market is full of supplements which are probiotics and prebiotics, but everyone doesn't need a supplement, though they are actually very, very important for us. They have a huge important functions which they have, from reducing inflammations to fighting through aging, improving mental health, good digestion and everything. But if you are having a lot of fiber in your diet, if you are having good fermented food, like using curds, using fermented idlis, kombucha, tofu, soya bean, all are very good. Similarly, you are eating good nuts, you are having banana, ginger, garlic. These are prebiotics. So if you are having a good combination of homemade food, you are actually fulfilling the RDAs of pre and probiotics in your diet. The moment you feel any symptom that you are having indigestion, you are having constipation, you are having diarrhea, or you are always having abdominal pain, then definitely with the advice of a healthcare provider or your dietitian, you can have a supplement. But pro and prebiotics are readily available in definitely Indian food, right? So now, going through a balanced diet, which is very important, because I always believe in that. With one food, you cannot have a healthy lifestyle, right? The advertisements are there where they say that you add berries and you will not have cancer. You add this thing and you will not have that. This is all a myth, because at the end of the day, what matters is that you are providing your body with the required nutrients, and that can only be there if you are having a proper balanced diet, which is having all five food groups in a day. Sometimes what happens that we feel that we are eating healthy, but there was this couple who had only fruits and vegetables only in the diet, in the form of soups, and they were onto a new diet, which was a raw diet. But then what happens is, the moment you are not eating enough proteins and carbohydrates, there are other problems which happens. So if you see the plate, the amount of fruits and vegetables and amount of the grains and the cereals is equal. Similarly, you should have at least 2 servings of your protein from non-veg or dals or beans, and one portion from your curd and milk. And also, there is a smaller portion for the foods which you like, because the moment you stop eating food which you like, maybe it can be sugary, depending upon if you're not having diabetes and everything. So that is very important for your mental health. Major foods which we are supposed to avoid are lot of caffeine. There are people who take lot of coffees during the day, because in the office they feel a kick and they don't feel sleepy because they had late night meetings and everything. So try and reduce your coffee to 2 cups in a day, or if you're having a tea, 2 to 3 cups a day, but not more than that. Apart from that, the caffeine is present in chocolates and cold drinks, and there are a lot of other things where caffeine is concerned. So reduce your caffeine as much as possible. Sugar, again, it's a sugar increases your anxiety levels. It reduces your immunity levels. It also makes your skin have all those wrinkles and everything. So stop having bad fats and sugar, alcohol, and smoking. So, what we should do to have a healthy gut, based on whole plant-based food, we should focus on. We should have more of the complexer version of carbohydrates, like millets, like dalia, and we should stay away from plain sugars. Say, for example, instead of juice, try and have fruits. Instead of rice, have some quinoa or a millet. So, or even if you're having rice, add lot of vegetables into it. So a good complexer version of carbohydrates is a better option. Protein, nowadays I get two types of people: one who are having very less protein, and one who are not, even if not needed, not required, they are having too much of supplements, and their protein is exceeding more than 100 to 120 grams per day. So I would say that, first of all, supplement is not for everyone. The moment you think that you need a supplement, please at least take an advice for any from a healthcare advisor. Because if you are eating good amount of dals, nuts, soya bean, milk and milk products, if you're a non-vegetarian, chicken, fish and eggs, you can meet up the protein part. Say, for example, for females who are not an athlete, who are not working for more than 1 hour in a gym with heavy weights, 40 to 45 grams of protein is more than sufficient. For maize, the range goes from 50 to 60 grams of protein. Nowadays, the hype is that you should have 100 grams of protein, 80 grams of protein. That is in some specific people, if your height is more, if you're going into gym, or if you have other medical issues wherein we end up giving more protein, then it is okay. But for a normal person who is not having any problems, 50 to 60 grams of protein is more than enough. Specific vitamins and minerals which we should consider in our diet are vitamin C. Definitely, it helps you to improve your immunity levels. Vitamin D and E, A and B, they are all antioxidants which are very important for us. When it comes to minerals, zinc, iron, selenium, and magnesium, these are important vitamins and minerals which are very important for our gut health. The moment we say that a person is having anxiety and depression, we go and check their vitamin D and B12 level. The moment you are having more anxiety problems, the more you are nervous more, just check your B12 level, because sometimes because of that you are having it. So B12 and vitamin D plays a very important role in your mental health problems. Similarly, vitamin C also boosts up your energy and your mental health. The kids which go for exams, I always say, before exam, take something which is rich in vitamin C, and you'll perform at least 10% better than what it was. This is a major topic. Fats, we have a lot of people who say that right now we should go for a zero fat diet. I would not agree with them, because we definitely need good fats. So but then when it comes to oils, I always say that have fats which are inside the food, right? Like, if you are vegetarian, so yolk has got fat, but then it has also got zinc, it has also got vitamin D, iron, B12. So take that fat. Nuts, seeds, they are having all good mufas into it, omega 3s into it. So include at least 3 to 4 teaspoons of seeds and 15 to 20 nuts in a day. That ways you are adding good fat in your diet. But when it comes to visible fat, the fat you can see, like ghee, like oil, these are the things which we should reduce as much as possible, because we have a sedentary lifestyle and fat has got maximum, it is a calorie dense thing, right? So when it comes to oil part, ensure that in a whole day you're not having more than 2 to 3 teaspoons of oil or ghee or anything, whatever, but it should not exceed 2 to 3 teaspoons in a day. Similarly, a very big no to a fat which we should go for is a trans fat, which comes into anything which we buy from outside and is fried, like chips, like bhujia, like samosas and pakoras, which are we order from all those Haldirams, Bikaner, and all other shops. What happens is that they reuse the oil, and reusing the oil increases the trans fat, which turns into free radicals inside our body, and they cause a major problem to our gut. So the first thing which we're supposed to say a big no is fried food from outside. If you want to eat something fried, if it is possible, make it at home, or you can steam it, or you can just shallow fry it at home. Second most important thing is that keep changing your oils as much as possible. There are few oils which are much hyped, like canola oil. I would say canola oil is not very good for your mental health, and you should try and avoid it completely. When it comes to olive oil, and extra virgin olive oil is good, but then the oil which is synthetic, which we call a pomace olive oil, is again not good for your brain. You should try and avoid it. Prefer not having oils which are synthetic altogether. Go for cold pressed oils which are actually very good for your gut and your brain, both of them. So try and have a rainbow diet. I mean, more colors in your diet, better your immunity is, better your gut is, and if your gut is better, your mental health is also good. At least 5 to 6 servings of fruits and vegetables daily is the target which we have to go for. Again, for the superfoods, I guess people say things which are like, which are very, very costly and they consider as superfoods. But I would say anything which has got more than one nutrient, they are considered as superfoods. Say, for example, I consider all types of citrus fruits, as a superfood. So it is winter, and amla is there, which is readily available. Kachi haldi is available. Uh, Beetroot is available, oranges are available, red capsicums are available. They are actually very good, and if you can use them on a regular basis, I guess they are anti-inflammatory and they do a lot of good to your gut. Similarly, all the colorful vegetables, homemade chutneys, which are again a very good option to add lot of condiments like ajwain, jeera, cinnamon, ginger, garlic, spices, all made up in the form of chutney, and it is easy way to have it, and we consider it as a superfood. Also, what happens is that the moment you are traveling and you say that, because of the traveling I have to have a snacks, you can make your own granola bars or trail mix, which can be comprising of some dried fruits, some cranberries, some raisins, some pineapple, apple, papaya, which are in a dried form, along with some nuts, along with some crunchy grains, like, you can dry roast the oats or sesame sticks or something like that, and you could add something else also into it, like whatever you feel like, and can make your own trail mix, which you can carry it with you when you're traveling, and you can have that whenever you feel hungry. So these are few anti-inflammatory recipes which I would suggest you in these winters. We should try it. First is turmeric milk. The people who are allergic to milk at the age of 40, half of us cannot digest milk. So you can also make it in the water. You can, boil some kachi haldi with some black pepper and cinnamon and ginger, and have it just like that. Or you can have it with milk if in case you are not lactose intolerant. Cinnamon tea, which is again a very good for your digestive systems. You can just boil some cinnamon, some cloves, and some tulsi, ginger, and just have that. Healthy soups, which again plays a very important role in your digestive system, because first those soups have a lot of spices like mochi lychee, ginger, garlic, along with some vegetables. Fiber is there, so your gut feels happy after having all those healthy soups. Instead of normal water, we can start having some detox water. You can add some lemon, ginger, along with some one any one spice. It can be either dhania or a jeera or a ajwain or a cinnamon or a methi. What happens is that it makes your water a bit alkaline, and it can balance your pH level. The sprouts, again, I feel it, they again are anti-inflammatory and are very rich in protein, easy to digest protein. So if it is possible for you, you can add that in your diet. Some healthy snacks options which you can pack from home if you are having long working hours and if you don't get time is are written here, like some idli charts or a chilas or some sprouted charts. You can have dhokla, khandvi, thepla, poha or murmure in the form of namkeen, which is have a shelf life of more than a week. Or you can also have some peanut or almond butter along with some veggies. Or if you feel really really hungry, you can carry healthy chapati rolls with you, which again you can have it in the evening instead of a sandwich rich in mayo or some chips or something like that. These are the healthier options in the office if you want to go for it. Some light snacks which you can have are like some seed mix, makhana, peanuts, buna chana, nuts, baked khakras or theplas. These are some snacks which you can have in the evening. Now coming over to supplementations, that what are all important supplementation if your gut is not functioning well, what we have to look forward to. Again, I would say omega-3 probiotics, vitamin D and B12, I've already told you, along with magnesium. If you have a lot of IBS issues, if you have a lot of digestive issues, these are the major supplementation which we look forward to. But it doesn't mean that blindly you can just pop in because you have a problem. So let's see how it goes. First of all, we'll check the levels and we'll see that whether you are actually deficient or not, and then we prefer giving you the supplementation. Then comes vitamin C, and I am a strong believer in that we have a lot of food which are present, and we can get vitamin C through food, and supplementation is not necessary. So in case you are having a lot of issues, you can have vitamin C as in food. And for the supplementation, what happens is that if you take supplementation more than 500 mg for vitamin C, again your gut is not functioning well. So don't pop in vitamin C just like that. Be careful with it. With the food, I guess if you're not hydrating yourself, even if you're having good food, there will be a problem with your gut. I've seen people who, there was one of my patient who started having isabgol, and then they were not hydrating well. What happened was that they were severely constipated, because if you're increasing your fibers, you have to increase fiber along with that, water along with that. It is equally proportionate to your fiber intake. Every 10 gram you have to have 2 glasses of water. So it is very important for you to have at least, because winters are coming again, ensure that you are having 2.5 to 3 liters of water on a daily basis. I don't have to tell you the importance of fluids, because everyone knows it. Exercise, I guess, is again a very important part, because it detoxifies your system. Along with it, also increases the blood circulation throughout the body, and it helps you to release some serotonin hormone, which is a good hormone. And it also helps you to reduce some cortisol levels. So when it comes to inflammation, when it comes to stress hormones, the moment you exercise, specifically when you exercise in the form of yoga or cardio, your cortisol levels goes down. So I guess that it is very important for you to go for at least 45 minutes of cardio, and a deep breathing exercises of 10 minutes, which sometimes people say are not good, but I have seen the result with the patients I have advised. If we're doing 10 minutes of deep breathing exercises, your mental health and your digestive health, both of them have a drastic change in a positive manner. So I guess in the end, I would say that a major food rules for a healthy gut are that balance your blood sugar, avoid a spike. So people who are eating two meals and are two very big meals, and then they are having a long gaps in between, what happens is that they have a sugar spike. It goes up and then it goes down. So this is something which is not good for your gut, and you should try and avoid it. You should have a high fiber thing. So eat more vegetables. Third most important thing is that graze don't gorge. I've seen people who finish their lunch or dinner in not even more than 2 minutes. They'll just finish two chapatis and the vegetables and the dal. They'll gorge on it. They'll swallow it. Please chew your food as much as possible. Uh, Normally we say 32 times we have to chew, but then chew longer, eat less, and eat early. In my first slide, I have told you that we have to follow our circadian rhythm, we have to follow our biological clock. Now there is a new research which says that people are having troubles even if they are following a healthy diet, a healthy exercise and lifestyle, is just because they are not following their biological clock, and they are working more than 16 to 17 hours in a day, and they're eating timing, they're eating right, but their timing is haywire. So I would always suggest that follow your clock, eat early as much as possible. It is not in our books that we have to have dinner by 8:30. Even if you had your proper lunch at 6 7 o'clock, you can have a healthy snack and you can say full stop to your day when it comes to diet. Another thing is that eat smart fats and protein more. When we say smart fats, they are the combination of nuts, seeds, cold pressed oils, and extra virgin oils, and smart science based supplements. I have already told you, like, there are so many supplements, like probiotics are there in the market, B12 supplements are there, vitamin D, but then they should be taken with the advice of a healthcare provider. So in the end, I guess To keep your energy levels high, you should always prefer having 6 to 7 hours of proper sleep, wherein you're getting 4 hours of deep sleep. Breakfast, I am not in a favor of, skipping the breakfast and straight away having your lunch at 1 o'clock. That actually releases stress hormones in your body, and the start is again the baddest start. Fresh air and breathing exercises, these are the vitality boosters which we should look forward to. Vitality robbers are alcohol, smoking, stress, anxiety, and allergies. So just to stay hydrated, eat whole, minimally processed food. It is the sum up of my presentation. Manage your stress and know your side effects. The moment, sometimes we are not aware that what our body is about to tell me. You have a slight pain and you ignore it. So this is the most important thing, that know your side effects. Know your that I had this and I had a side effect, so we are not supposed to have it again. Sorry. That's it. So this was my presentation, and I guess now yes. So after this, I guess we can have a questionnaire, or if you want to ask me any questions regarding gut health, we can discuss it out.
Yeah, the first question is, doctor, do we need to have dinner?
So this is definitely, we do need to have dinners. I've seen a lot of people who just have their lunch and then they don't have anything. The major problem they have is of constipation, because at the end of the day, you cannot have that much of a fiber in 2 meals. So it is important, but then dinner post 8 o'clock, I would not suggest you. So post 8 o'clock, you can have vegetables in the cooked form. Also, there is one thing which I skipped. In the night, prefer having cooked vegetables instead of raw vegetables. Because when it is a raw vegetable, it takes longer time to digest, and then you can have acidity problem, belching problem. Some of us have. So prefer having soups and cooked vegetables.
Yeah, and in the morning, early breakfast, do you suggest having fruits first, or what is the suggestion on empty stomach?
So the moment I say on the empty stomach, I would definitely say start your day with some almonds and fruit.
Okay.
Uh, After that, have some protein. It could be in the form of sprouts, it could be in the form of eggs, whatever. And then followed by a very small portion of carbohydrates. Because this combination will keep your energy levels high for a longer duration of time. Too much of carbohydrates, say for example, you had too much of carbohydrates in your breakfast, you'll feel lethargic. You need protein for your mind to be alert, right? And fruits are having not only the carbohydrates but all the other essential vitamins and minerals. So I always say that have fruits first thing in the morning, but it should not be a citrus fruit, like oranges or things like that should be taken in the afternoon. Yeah,
So only fruits is again not good. Only fruits or
definitely not good. Again, that is only carbohydrates. So all your three major meals should consider of carbohydrates, protein, and good fat. So our ideal breakfast is, some 200 to 300 grams of fruit with some 10-15 nuts and some carbs, like you can have, some oats, some dalia, a poha, or smaller portion. So the moment you combine that, you're giving your body the needful nutrients of that time. Only fruits. That is what I told in my presentation. Only fruits and vegetables throughout the day. There was one of my patients who was doing it. They were on a raw diet. But that is actually, you will have a lot of deficiencies in a longer run.
So what about milk? People say don't drink milk in
Yes,
the
there are a lot
breakfast.
of there are a lot of controversies on milk, and I also don't give milk to people who have hormonal issues. Because right now, what happens is that the milk we are getting has got a lot of estrogens, a lot of hormones inside. and that creates a lot of issues. But when it comes to males, I guess there is less problems when it comes to females, you know. So
Okay.
but I always say that when it comes to milk, have curd, have buttermilk, but when it is like milk as a drink, restrict it to 200 to 300 ml, not more than that.
And those who are pure vegetarian, like who
Yes.
doesn't take even egg, okay.
Uh-huh.
So for them, what do you suggest? What should be the
For
supplement for fish or egg or mutton, whatever? What should be
See,
the
when it
uh,
comes to protein part, you get a good
hmm.
amount of protein in dals, in soyabeans, in chanas, in sprouts, in nuts, in seeds, right? That is what I was telling you, that the fact that you are a pure vegetarian, it doesn't mean that you cannot have the protein through food. Right now, vegan diet is much more popular, and people are going vegan just because the non-veg items are having lot of hormones into it, which are giving you more problems than the benefit, right? So
Yeah.
even the grains, the millets like bajra, quinoa, all those have more protein. Per serving, they have 2 grams of protein. So the moment you have a proper balanced diet, it is very easy for you to get 50 grams of protein through diet. But you have to ensure that all the 3 major meals have 1 protein into it, and 2 snacks which has got protein into it. Easily you can get your protein through vegetarian stuff.
Do if we avoid totally any animal produce, that is milk, eggs, or meat, is it advisable?
So that is your personal choice. I mean, here I cannot comment on that. But I don't believe also. I mean, you should have curd. I'm very much into that. You should have yogurts because they are very rich in probiotics. They are the probiotics. But in case you are avoiding it, then there are other resources from where you can get everything. That is what my point was.
Ma'am, how about a gluten-free diet? Is that okay, or it has some disadvantages? A gluten-free diet.
So, So what happens is that normally the moment your body is not able to digest gluten, we tell you to have a gluten free diet. In case without any reason you are following a gluten free diet, what the major thing is that you are saying no to lot of food items which are your favorite. Second is to prepare a gluten-free diet takes an effort. So if you can make a proper gluten-free diet, it is a good diet because what happens is that wheat protein causes a small amount of inflammation inside the body, right? So a gluten-free diet is a good diet if you are able to follow it, easily. If it is causing you stress and you are able to digest gluten, then definitely few things like dalia, like chapatis you can add. There is no necessity for going for a gluten free diet until or unless you have symptoms, right? I mean, lactose free diet and gluten free diets are specific, patient specific.
So,
Yes, Abhishek ji.
just one question I have, ma'am. I've heard something of concept called basic breakfast. So,
Mhm.
what is it actually? Just wanted to understand, and is it advisable?
Basic breakfast. Hello.
Yes, ma'am. Yes, basically, uh,
I,
that's it.
I have not heard about this basic breakfast. If you can elaborate on that.
Alkaline. Sorry, it's basically alkaline breakfast.
Acha, okay. So see, alkaline is definitely in alkaline foods, like are because the moment your body is very acidic inside, it causes lot of gut problems. That is why I have already told you that start having detox waters, because with that what happens is that water turns into a bit of alkaline in nature and can help you to have your system a bit alkaline, right? So having a alkaline breakfast, again I would in this thing I'll tell you that if you make your major meals a bit complicated, what happens is that you are having less choices. right?
Hmm.
So having a alkaline breakfast, but then you are having tea and coffee in the office, which is, very acidic, or you are having alcohol, or you are having sugary drinks, right? So first of all, when we say what we have to omit is, first of all, omit those things. Then come to alkaline breakfast. It is, tomatoes and all the stuff will be not there. Whosoever is making breakfast will be confused what to make for you, right? So find out things which you can easily omit to make your system alkaline. Right, like have soups, have lot of vegetables which are alkaline in nature, and make your breakfast, lunch, and dinner so simple that it is not very difficult to prepare it.
Correct.
So then you will be able to follow it. I have seen, I mean, whenever I give a very fancy diet chart to my patients, they are not following it.
Because
When
they are not cooking, it is at the home
they're
that they
not
are cooking
cooking,
and
and
keeping.
yeah, the moment I tell them na sabzi roti dal khani hai, so at the end of the day, quantification they can do.
Correct.
है ना? तो हमें मेजर मेजर मील में अगर जरूरत नहीं है, तो हमारा जो भी हमारा ट्रेडिशनल ब्रेकफास्ट है, सो आई ऑलवेज आस्क 24 आवर्स रिकॉल. कुछ लोग हैं जो सिर्फ चावल खाते हैं, कुछ हैं जो चपाती खाते हैं, उसके बगैर उनका चलता नहीं है, राइट? तो अगर सब कुछ ठीक है, तो हमें जितना ज्यादा हम अपने बेसिक या अपना जो पहले की डाइट है उस पर रह सकते हैं, उतना रहना चाहिए. और जो अलग चीजें हैं ना जो हमारे सिस्टम को एसिडिक कर रही हैं, जो हमें इन्फ्लेमेशंस दे रही हैं, पहले हमें वो वाला लाइफस्टाइल चेंज करना चाहिए. और उसके बाद भी नहीं हो रहा है, तो फिर वो हम थोड़ा सा जो भी कुक कर रहा है उसको थोड़ा प्रेशर देंगे कि अब खाने से ये हटा दो मेरे. बट जब तक पहले हमें ऐसे ट्राई करना चाहिए, है ना? तो मेजर वही है सर. हाँ जी.
Yes, just one thing. Is it possible to get that PPT? Because I really joined very late. I mean, your last slide only. At that time, I could join.
अच्छा,
Yes.
PPT में there are only pictures. There's nothing much into it. But then I'll discuss it with Namisha
No,
if
no,
she can
doctor,
take
what I will
those.
request
Yeah,
is
no
that
issues.
many of
Great,
them
great.
join late.
Thank you.
Doctor, if you can.
Okay, one more thing. One more thing. People says don't use sugar, use jaggery, and you start with jaggery water in the morning. What do you say about this?
See, I always say that jaggery and chini and khand are one and the same thing.
Okay.
Right. So recently I went to my one of guests' place, and they were diabetic and they were using khand instead of sugar, telling me that it is better for diabetes. And I was like that the glycemic index of both of them are equal. Right.
Okay.
So of course, if you are fond of good in a small amount, I have given it to people who have digestive issues, good and some ajwain mix
Okay.
together and make a small balls, like we have
Mm,
gems wale balls jo chote chote hote hain,
mm, mm.
and then have it post your lunch and dinner. So the people who have craving for sweet immediately goes, and because that gur has and ajwain into it, what happens, it helps you in digesting whatever food you had. So in that, a small amount good is not a problem, but if you're eating it in a larger amounts, again the effect is same.
What about doctor gur and sprouts in the morning?
It's a good combination. Sprouts is a protein and good is a carbohydrate. Obviously, you have to see that the amount of good is not too much, but you can have it till the time you're not having any diabetes and any liver issues. You can have it, no problems.
Ma'am, vinegar in the diet, would you advise like early morning drink or something like that with
No,
vinegar and stuff like
I
that?
always say that when it comes to vinegar, it is definitely a very good thing for our digestive system, but you should have it along with your meals. If you go through, I mean, still there are people जो वो सिरके वाला प्याज खाते हैं, right? What happens is that this sirka is very acidic. Apple cider vinegar is an acidic stuff, and the moment you eat it with the food, all the food is better digested. So,
Okay.
so if you're having it early in the morning, basically, then I don't know why you have it. But if you are having it, have it with your meals. That is the best way of having it. Half an hour before meals.
Okay. Thank you. Thank you.
Yeah. Any other queries? Anyone?
What
No?
about roti? Roti in the this thing?
Routine?
In place of rice, which is
Oh, you
preferable,
can
roti or
have.
rice?
See, I would say there is nothing called preferable. It is what your, there are rice eaters, there are chapati eaters. So the moment you are a chapati eater, हम 4 रोटी के बराबर चावल खा लेंगे, हमारा पेट नहीं भरेगा, है ना? But when it comes to your digestive health, always prefer adding some जौ का आटा, काले चने का आटा, or some fiber into your normal atta, so that it is fiber rich and you can have your chapatis. There is no problem.
So,
Portion size has to be controlled, not too much.
between rice and chapati, it is
Yeah.
easier to digest rice, I understand.
Yeah. Rice is easier to digest, but then till the time you're not having any digestive issues, right? And you're able to digest chapati just for sake of changing your major item of a meal is not right, right? The moment you have any problems, the moment you have some digestive issues, then definitely we say go off the gluten. We also go for a gluten-free diet for IBS patients, for ulcerative colitis patients. But then till the time it is something which we don't say is a preventive measure that you should not have IBS, you should stop having chapati. No. If you want your gut to function properly, you should have 5 to 6 servings of vegetables. You should have lot of water. You should have anti-inflammatory diet. And as Vikesh said, that your system should be alkaline and not acidic. So stay away from lot of tea, coffee, cigarette, alcohol. So if you're following it, even then there is no problems. You can have your chapatis also. You can have your parathas also. Right? We come to a rice diet or a gluten-free diet or a lactose-free diet when there is a symptom for it. Otherwise, a proper balanced diet is fine. No need to change. Yes, Siddharth? Okay. So I guess, yeah. So I guess I can sum up my session with 3 takeaways for you guys. First is that please start having home-cooked meal instead of packaged and processed food. Second is that stay away from all the fried food because trans fat is the biggest culprit. तो जो समोसे पकौड़े नमकीन भुजिया और ये सब हम खा रहे हैं वो हम नहीं खाएंगे. And third is start having a deep breathing exercises and a regular exercise with lot of fluids and follow your biological clock. Don't eat more of carbohydrates after 8 o'clock. क्योंकि system shut down हो जाता है उसके बाद, right? So if you're following it, I guess you are actually having a good gut and good mental health, right? Okay. So we can end the session with this, or any other queries left? No? So I guess let's have a very good evening.
Thank
Enjoy
you.
your Sunday evening.
Thanks a
It
lot.
is on Sunday you have joined. That is good. Take care.
Oh.
Yeah.
Thank you.
Well, thanks, doctor.
Thank
Thanks,
you.
everyone. Thanks for joining the call. Thanks, Siddharth. Thanks, everyone.